Okay, first of all, thank you for joining us, Doc. Can you tell us about yourself and your current situation now?
Hi, I'm Noel Tangco, and I'm a general physician. And I've been a person under monitoring since March 10. So basically, asymptomatic, walang sakit, pero naging close contact or nakahalubilo ng isang confirmed case na yung tito ko na namatay noong March 13.
Alam ba ninyo kung paano nangyari yun?
Yung specifics, hindi namin alam yung kung paano mismo nangyari. Pero huli kaming nagkita March 7. Family dinner in public. And then yung COVID, it's already in the news. Tapos sa family, siya yung pinaka-aware actually na nung nagpatian na kami nung day na yon, nung night na yon, ano na, yung elbow tap, wala nang kiss-kiss. Pero he already had a fever for 3 days. So, in a table of doctors, kasi family of doctors kami, and we all thought na it was UTI. Parang may prostate problems din kasi siya eh. So, we thought na yun yung meron siya. So, we had blood and urine test done on March 9, tas nag-normal. He started having difficulty of breathing on the 10th. So yun, my dad checked on him, and then no personal protective equipment at the time.
Your dad is also a doctor?
My dad's also a doctor. And nung siya yung nag-check, wala pang PPE nun. Hindi pa naka-mask, hindi pa naka-goggles. And then may narinig nga siya sa baga. And then nung na-admit siya, yung tito ko, nilagyan na siya ng oxygen agad. And then on the 11th, yun nga, I hear news na he started coughing, and then he started coughing blood. So by the next day, yung 12th, for intubation. By midnight, ayun nga, pabagsak-bagsak na yung BP niya. And then before we knew it, yung family, tsaka before he knew it, he was gone. And then PCR results niya, nag-positive the next morning pa. So from that day, from yung last point na na-meet nung tatay ko pa yung tito ko, yun yung start nung count ng 14 days namin.
I see. And
that's PUM.
PUM yun. And of course, we're obviously very sorry about your tito's passing. How has that affected your entire family from that day na nalaman niyo na COVID siya, of course, nung namatay siya?
So, in terms of yung death, yung logistics nung death, we had to have him cremated agad. Parang, at that time, worried din yung hospital na mahawakan yung body. And then, syempre, yung crematorium, concerned din sila sa staff nila na hawakan yung body. Pero at that time, covered na yun ng DOH, na yung transfer ng body, it's fully protected, naka-wrap lahat. You won't see na, yun yung sad part, you won't see na your loved one's face anymore. Parang darating na lang yung fully wrapped body bag na nandun yung pangalan niya. And then, yun, had him cremated, no ceremony. And medyo mahirap masanay sa ganun kasi this is someone na very important to you. So we still found a way na since then we've been leading an online novena, and then kung sino magkasya sa chat room, we would pray together yung usual na 9 nights, ganun. Yeah. So yung maging helpful sa grief namin na nasa family is yung hindi kami nag-focus sa hindi pwedeng gawin. So we can't have a meeting, we can't have a social gathering, pero we focus on what we can do. And siguro like this opportunity then, we still find a way to tell his story. So by the time of this interview, my self-quarantine, yung 14 days mula sa last point of contact ng aming buong household sa tito namin is today is the 14th day. Pero it doesn't change much from our perspective. Yung only thing na nagbago is we can say with some certainty na hindi kami nahawa sa tito ko. Like, yun lang. Kasi yung what doesn't change is that the virus is still out there. Na hindi tayo makakasigurado na sa paglabas natin ng bahay, hindi tayo mahahawa sa kapaligiran. And I live in a household with 3 senior citizens na lahat may high blood, some may diabetes. So before news, syempre we're all watching the news, so we're all waiting for news of containment. Locally, within Metro Manila, hirap kaming makagalaw after, even at this day na tapos na yung aming quarantine. Kasi natatakot pa rin kaming mahawa mula sa labas.
So in that sense, the different challenges ng being in quarantine because you are a PUI is no different from everyone else who's also staying at home because natatakot din sila na baka mahawa din sila sa labas, di ba?
Yes, very similar.
Pero are there any unique challenges that you had to go through, especially nabanggit mo kanina na may 3 senior citizens kayo sa bahay? What precautions did you guys take? How did you ensure na the risks are minimized?
Yeah. Living in quarantine tsaka in isolation, yung hardest parts kasi nun parang can be summarized in like 2 ways. Na the one part is you have to get used to living under fear.
Okay.
And then the second part is how do you elevate your knowledge? Parang paano mo iakyat yung pagkaunawa mo ng sitwasyon? Kasi manggagaling sa pagkaunawa mo yung magiging pag-ingat mo moving forward. Kasi hindi mawala yung takot, pero pwedeng mag-ingat. Na yun yung magpapababa ng risk. And yun, common, sobrang common marinig yung kwento nung first challenge, yung may fear, may takot. Kasi nag-manifest yun sa social media, sa balita, as yung mga panic behaviors na naririnig natin na nagkakaubusan sa supermarket, tulakan, siksikan sa mga public transport, panic testing, and hindi mo din kasama yun sa takot. And parang hindi din pwedeng hindi rin pwedeng bintangan yung tao na ganun siya nag-act dahil takot siya, ganun. So, yun, naging helpful yung pag-aaral, kasi yung understanding yung news or information na lumalabas. Kasi naging useful yung aking medical background dahil pag nakarinig ako ng balita, alam ko kung ano yung totoong bad news, ano yung totoong good news, tapos ano yung nagiging useful, ano yung ibig sabihin ng good news na yun. And usually the good sources are from the WHO, and those guidelines protect you within your home and when you have to do essential errands. So yun.
So you're in a unique position because you're both a doctor with a lot of training and experience, and then at the same time you had to experience having a family member losing a family member to COVID. Do you have any, I would say, advice or messages to families that might have a PUI also in their family or might be going through similar circumstances, both as a person, as someone that's experiencing this now, but also as a doctor?
Yeah. As a doctor, I'm not an expert. I'm also a student of this growing body of knowledge regarding this disease. Na parang our understanding of this disease is incomplete. Although, you hear doctors speaking of it in familiar terms, the truth is it's a new virus. Never ka pa naman nakarinig ng sakit na walang gamot. Well, ito yun.
Mm.
And how does that change things? Parang, and it's so hard to visualize. Wala yun sa experience nating lahat. Like even the doctors that you meet in the front line, this is new for them. We're all learning about this for the first time. And it's so hard to visualize na kunyari from where you are, from how you've been absorbing the news, for example, how the news has been reaching you. Parang it's so hard to visualize. Ang hirap maging konkreto sa'yo na how can a virus na kayang patayin ng 20 seconds ng hand washing, kaya ring makapatay ng tao? Or bakit bang importante na hindi makipagsiksikan sa mga pampublikong lugar? Bakit kailangang maglaan ng kubyertos, ng tuwalya para sa isang PUM or PUI within your household? And sa totoo lang, those are basically yung parang cornerstone ng mga advice ko kasi as a person under monitoring, these are useful skills na konkreto silang action na limit the spread of the virus. And nagkakatalo lang dun sa pag isa ka na ng PUI or person under investigation. Kasi the reality is, although totoo na lahat tayo kailangan matest, yung reality is hindi pa tayo makahabol sa testing. We don't have the infrastructure yet. And testing is important. It's one of the important tools in fighting itong invisible na enemy. And so far, sa emergency room, yung ina-admit lang ay isang senior na may mild na simptomas or kahit anong edad na malala yung simptomas. And kahit hindi clear kung may nakasama ba siya or wala. So in the meantime nga, we try to stick to what's practical and what we can do for each other. And a lot of the things that we can do are doable and very practical. And then, simple lang yung tips, pero ang layo ng mararating. And we forget. We forget na kahit nagbago yung way of life natin, ay hindi pa rin magbabago yung the way we care for each other. And even in isolation, even pinipilit tayo na ipaghiwalay, we still try not to keep anyone from feeling alone.
It's very important, no? I think I'm wondering, like, all of this talk about social distancing, quarantine, is that it's not meant to isolate us, right? It's actually meant to protect us and our way of life, so to speak, by ensuring people don't get sick, and at the same time, people don't overwhelm our healthcare system. Can you tell us more about that? Can you give us that? Sabi mo, it's simple tips, but medyo mahirap isipin. What is the bigger picture here? Why are we doing all of this? Social distancing or physical distancing and quarantine and self-isolation?
I think you're right there I think you hit it there now. We're protecting each other. And we kind of have to behave nga na dahil mahina yung testing pa. Like we're waiting for it to catch up. Yung whole world naman na catch off guard. And we're supposed to learn from the experiences of our neighbors, our neighboring countries. And we are protecting each other. And I think kasi yung nakadagdag siya sa takot eh. Kasi I feel that, we have like some confusion with the terms that are used interchangeably. Like we have social distance on one hand, self-quarantine on the other, social isolation on the other, and then lockdown. Na these four are like used interchangeably. Yung pinaka-troublesome sa kanila is lockdown. Kasi yung easy assumption sa lockdown ay prisoner. And that's a scary proposition. Social distance, for example. Basically, in terms of talsiklaway, kasi yun yung route nung virus eh. Yung droplet ng laway magland sa tao, sa surface, sa handrail, sa doorknob, something na hindi palagi ang nililinis, droplets. So social distance na parang from this day hanggang makaimbento ng vaccine, we have to keep like 6 feet apart from each other. Self-quarantine is staying alone, staying apart from other people who most likely won't have it. Kasi within your experience, you think you have it. And because there's no testing yet, we're still waiting for testing, parang we kind of have to depend on yung hinala na yun. So self-quarantine is 14 days of limiting your own movements with the environment na parang if you can get help with your essential errands na you don't have to leave your household, which is what yung ginawa namin for 14 days. Yeah, self-quarantine is about that. The 14 days na based yun sa yung incubation period na you're hoping walang mag-grow sa'yo. Ganun.
And
you're
what happens if
observing.
we don't follow these guidelines?
We don't follow these guidelines is there's a chance na pwede kang maging asymptomatic carrier na you don't feel anything. Pero when you go out and may nakasama kang nakatatanda for any reason, either nagkatabi lang kayo or may chance na malipat. Lalo na pag hindi niya nahugasan yung kamay niya, may nahawakan siya na may virus, and then na-touch niya yung mata niya, yung ilong niya, yung mouth, which is something na actually ang hirap din i-catch kasi on average, how many times do you touch your face, di ba?
Yeah.
And then social isolation is basically, that pertains naman to like our way of life na we can only go out for essential things. And we're lucky now in a time of technology. Now we have all these screens to keep us connected. So at least we have that going. Where social isolation is limiting your movements with the community, limiting it to essential activities. So it's three similar concepts that are used interchangeably. And because there's a fourth term, na lockdown, it's scary to hear. And lockdown kasi is usually used in terms of security also. So I get why like it would be a word used by government because this is an issue of national security. But I can understand why it would add to the fear and the confusion in these three things that are important. Mm-hmm. So social distance, when you go out, you give space for the people around you. Self-quarantine, if you think that something happened to you, na nagka-contact ka or yung fever mo ayaw mawala, then you give 14 days observation na kung gagaling ka ng kusa or lalala. Mm-hmm. And then your social isolation is limiting your activities outside the house to only activities that you have to do.
Okay. Doc, sa balita ngayon, di ba, maraming lumalabas sa social media and sa news na yung mga hospital, nag-turn away ng mga patients or medyo napupuno na yung mga hospital beds or ICU beds because of the number of patients that are coming in on suspicion that they might have COVID or other illnesses. And at the same time, may mga balita rin na yung mga healthcare workers, doctors, nurses, other health hospital workers are exposed nga and might have to undergo quarantine or have contracted the virus and have unfortunately passed away. I think I have two questions. Number one, why did we get to this point, or how can we prevent this from being the reality that the hospitals are getting overwhelmed? How can we prevent that? Is there still time to do that? And the second is, do you consider yourselves, yung mga doctors who are there in the hospitals working with patients, do you consider yourselves heroes? And you consider yourselves making this sacrifice over and above your regular duties as doctors?
Sometimes I feel na misleading yung term na frontline. Like when you refer to the doctors as the frontline, because they're only able to deal with the worst hit of us. Like the limit of our healthcare can only, the current structures in place can only deal with the ones who are worst hit among us. And until we do our part, until our curve flattens out, they might not be able to reach or defend most of us. So to refer to them as the frontline makes things more scary kasi hindi yun hindi yun strength natin currently. So in a sense, they're victims also. They're victims also. They're fighting an enemy now we can't see, waiting for weapons, that haven't been invented yet. And they have the same stories too. They are mothers and fathers, sons and daughters who also don't know when they can see their families again. And I agree, the stories coming out of the hospitals, medyo heartbreaking to be heard at a case rate of almost 500 pa lang, and to think na this isn't the worst of it yet. We might be looking at thousands of confirmed cases by the end of next month. So in a sense, sila yung pinoprotect natin by flattening the curve, by staying home, by keeping social distances, by lessening our chances of getting sick. Kasi that means less of us are vehicles for our invisible enemy. And we have to pitch in so that our hospitals are not overwhelmed. And the effect of social isolation, social distancing, will only be felt in weeks' time, in a month. And we're gonna still hear bad news from now until then. Pero hopefully we don't give up on hope. The point about the doctors being heroes, they're basically still providing an essential service. People still get heart attacks, people still get strokes. Wala lang sa balita pero nangyayari pa rin. So hospitals still try to provide that service on top of the COVID threat. But they aren't the only essential workers who are trying to keep life going as if normal. Although, these times it's not normal. And these are the supermarket workers, the delivery services, janitors, security guards, local government units, barangay health workers, bankers, trying to keep, some semblance of the economy to support people from all walks of life. And this is how we protect them also, by cooperating with this idea of social distancing and changing our behaviors within the house, outside the house. So I think it's more useful to think now when you use the term heroes is that we're all heroes. Now, if we all behave in such a way that it will be difficult, we have to make it difficult for the virus to hop from person to person, hoping that less and less people get sick with COVID over the coming months.
Thanks.
Yun.
Yeah. And so how do you see this playing out, no? Like, how this change our way of life? Kumbaga, for example, will seniors citizens be able to, still go out of their homes, interact because they're at most risk, diba? Will we be able to return to normal, or will there be a new parang adjustment that we all need to make, to ensure that the virus does not spread further?
I understand that these changes feel drastic. Kasi we have to understand din na yes, parang life has changed as we know it. And this is long haul. Like, I want to be wrong, pero we're looking at, for the next 6 months to a year, bawal magsiksikan, iwasang hawakan yung mata nyo, ilong, bibig, hugas lagi, clean surfaces, masks in public to be sure na parang when you're talking, hindi tatalsik yung laway mo and Kasi even the droplet, most important kasi yung droplets na hindi natin makita. And is there an alternative for these choices, these changes in way of life? Not really, hindi. Because the alternative, if we're not able to come to an acceptable local context of social distancing, then the alternative, if we can't find that acceptable middle ground, is more death. So no, that's not an option. There's no other option. So we have to think of this as our new normal. We try to deal with our fears by being more careful. And because it's a new normal, parang any change to our daily activities will feel weird naman talaga eh. But we will get through this, and it will take time. Pero now's not the time to want things to be normal. Parang, yeah, it's gonna take time. Like most governments around the world, we're caught off guard. So we have to trust that we can rebound from our rough start. That the people in charge I'm sure they're well informed, and they understand that we can't be making the same mistakes of Europe na late na kapag enforce ng makataong lockdown, and we can't afford to make the same mistakes tapos mag-expect tayo ng ibang resulta kasi I think that's it. Now we can't be any more late in getting into effective social distancing.
Yeah, totally agree with you with that. I guess a last question would be, that if that's the reality, and that's the reality that we have to all face and work through together, what would be, the good news? As you mentioned, there's both good and there's also bad news. What could be the good news here? What could we, take out of this and learn from this experience, both as a country, bilang Filipinos, but maybe the world globally? What can we learn from this pandemic?
I'm hopeful now we'll be able to find common ground in understanding what's happening to us. You say wherever you live now, however my story is reaching you, you're already probably feeling the effects of the pandemic. Now, for some, like my family, we've been hit a little more severely than others, and I really hope that whoever's hearing my story doesn't have to go through a loss like mine before you understand that things have to change for the time being. For on what I'm hopeful for is even if we have so many factors going against us, I really hope that people realize that this is a time that we need to come together. Because the way the fear is affecting us, I'm sad that the fear tends to pull us towards kanya-kanya mentality. Kasi kanya-kanya kasi nagkakaubusan when we should be pulled towards a tayo-tayo mentality. Na sana marami pa tayong matira pagkalipas ng COVID. Na instead of focusing on our differences, on our backgrounds, I hope that my kind of story helps us realize na pare-pareho tayong mga magulang, mga anak, mga kababayan na ayaw mawalan, ayaw maulila, at karamihan ng pwede nating gawin para mapabagal yung pagkalat ng virus sa ating komunidad, sa ating bansa, ay kayang gawin ng bawat isa. I'm really hopeful to move past our rough start. It's really sad to hear yung news, yung rising case rates. To move past our rough start, we're going to have to bring out the best in each other. Like it's the only way. Like yun isa sa mga strength natin as a people na it's within our context. It's in our brain na yung bayanihan. It's in the word, and we're all the heroes. So yeah.
Great. Thank you, Doc. Thank you. Maraming salamat, Doc Noel, for sharing with us your thoughts on COVID, your experiences as a PUI, and of course, we offer our condolences to your family on the passing of your uncle. Thank you very much.